Mode.
Good evening, and welcome to tonight's Family Support Center of New Jersey's webinar titled Transitioning Youth with Autism and Co-occurring Behavioral Health Issues, part of the Transition Matters webinar series. Please note, this evening's session will allow time for questions and answers at the end. We encourage you to type any questions that you may have during this session in the space provided, and we will attempt to get to as many as possible. At this time, I would like to introduce Dr. Esralew. Dr. Esralew is a New Jersey and Pennsylvania licensed psychologist and certified clinical neuropsychologist who maintains a part-time practice in Hamilton, New Jersey. She is a clinical administrator of the SCCAT and ESCO program of Trinitas Regional Medical Center. Dr. Esralew has over 20 years of experience in working with individuals on the spectrum and their families. She is a certified clinician through the National Association for Dual Diagnosis. At this time, I would like to welcome Dr. Esralew.
Unmuted.
Good evening, everybody. It's my pleasure to join you this evening and to talk about an issue that is very relevant to transitions and to transition matters, and that is the mental health of individuals on the spectrum who are transitioning from adulthood, from adolescence to adulthood. So I have a slideshow for those of you who are able to and are online and can see it. Otherwise, the rest of you can follow over the phone, and I'm going to be welcoming any and all questions. So the objectives for today's webinar this evening is to introduce the term emerging adulthood and its relevance to youth with autism who are transitioning to adulthood. And in that process, I'm going to overview the behavioral health challenges that can accompany the transition of youth with autism from adolescence to adulthood and introduce some considerations. Hopefully that will help you promote the independence and successful transitions of your relatives. Additionally, I hope to introduce some considerations that can help professionals and service providers with regards to the needs of your relatives as they transition from adolescence to adulthood if they have co-occurring mental health problems. So the term emerging adulthood is one that was first coined by a gentleman by the name of Jeffrey Arnett, a researcher in the field of development, in 2000. And he used the term and proposed it to refer to that period of time between adolescence and adulthood for individuals ages 18 to 25. And according to the article that he published in the year 2000, he indicated that individuals on the spectrum who are within that age, and by the way, he was also referring to people not on the spectrum, but a particular concern about those with developmental disorders, are not quite children any longer once they reach the age of 18, nor are they quite adults. And so they're in this in-between transition time in which they're transitioning in a number of ways. One of the ways, of course, that they're transitioning is they're going from youth services and the supports that they had as children to the services within the adult service system and world. They're also psychologically transitioning and looking, many of them, for ways to become more independent. Some of them are capable of taking on increased responsibilities. Increasingly, they're looking to make their own decisions. Some of them are desirous of more financial self-sufficiency, and generally they're moving away from a dependence upon the family. And this is developmentally appropriate. It may take some of our individuals on the spectrum a little longer to achieve this, but this is really the direction that those who can should be moving. This is a stage that youth with autism transition through, as do their neurotypical peers. This is also a stage, that period of time between the ages of 18 to 29, when individuals on the spectrum appear to be particularly vulnerable to emerging psychiatric problems. And so this is really what I'm concerned about with you this evening to pay attention to. Among the more prevalent diagnoses that we see, I see as a clinician and the members of my team through SCCAT see, are an increase in the diagnoses of anxiety disorders, mood disturbance, and substance use problems. Many of the psychiatric illnesses that we consider to be among the more significant problems are diagnosed before the age of 30. In particular, the thinking disorder we term schizophrenia, schizoaffective disorder, which combines thinking problems and mood problems, and bipolar disorder, are all illnesses that frequently have their first outbreak or first episode when the individual is under the age of 30. And of course there may be biological contributions for a person on the spectrum to being vulnerable to being diagnosed with psychiatric illness, but there also appears to be environmental stressors and increased demands upon these emerging adults, these transitioning young people. And that includes an increase in task demands on them, an increase in social demands, and less structure with more expectation of independence and self-direction. So let's just dwell on that for just a minute or so. So the increased task demands would come for individuals as they move from the more protective school setting to the adult world, where either individuals will be working or attending day programs or an expectation that they're going to assume some kind of adult tasks. Increased social demands because your relatives are moving from the point where they may have been within a certain school and setting for a period of time to adult programs where they're going to interact with larger number of individuals, many of whom they're first encountering for the first time, new staff who will have to become familiar with them and with whom they're going to have to be familiar. And it's less structure. School settings on the whole, when your relatives have their school entitlement, tend to be routinized. There's a great deal of structure and regularity. However, when they move into adult services, there may be less of that structure with more of an expectation that the adult is going to take on responsibility for their own routine, their completion of tasks. A greater degree of self-direction is expected as they move into the adult world. Now we know that there are aspects of being on the spectrum that for the transition age individual indicates that they may have increased vulnerability to problems. So individuals without structure or routine on the spectrum are at increased risk for mental health issues. And this is an area that as you help and work with your relative in transitioning to adult services, you want to put particular attention to what will they be taking on in terms of a structure or a routine. We want individuals to have meaningful ways to use their time, because if they do not have work or activities that are meaningful to them, they're at increased risk, they're bored, and it's more likely that this would contribute to mental health issues. Additionally, individuals need peer contact, and without the contact with individuals who've been in their school programs as they go into the adult world, it becomes harder to arrange regular contact with peers, And this is something we have to put a great deal of attention to so your relatives are not socially isolated and they have an opportunity to interact with peers and learn age-appropriate social and emotional coping skills. So individuals who do not have these opportunities to learn appropriate social and emotional coping skills are also at risk for behavioral and mental health problems. We know that individuals on the spectrum, many of them have anger management issues. It seems to come with the territory. And so we want to have opportunities for individuals to learn anger management skills so that they're able to control this in adult settings, whether it's at work or at day programs. Individuals who are on the spectrum may also experience a great deal of social anxiety or distress. And so particularly as they're moving into less structured situations with new people, we have to provide routines and the mechanism by which they will feel more comfortable in social settings at work and at program. So the ways to support your relatives who are transitioning to adult services is to promote the development of routine, structure, inclusion in social activities, and opportunity to pursue work and leisure interests, as well as opportunities to learn relevant coping skills, which include anger and stress management. I'll have some more to say about these as we go along. I just want to set up for you some considerations that although our youth with autism do have some increased vulnerability in this area as they transition to adulthood, there are ways we can help them build better coping and better equip them to meet their challenges. So what behavioral skills do your relatives need to be successful in making these transitions? Well, they need to develop adaptive skills or life skills so that they can be as independent as possible. To the extent that they learn how to take care, self-care, hygiene, grooming, have regularized bedtime, eating schedule, etc., they are less dependent upon others and more in charge of their daily routine. They're going to need skills that are involved with behavioral self-control because they're going to be in settings where acting out behavior problems are not going to be tolerated, and very often there are not going to be the supports necessary at work or at day programs that are going to help them if they are they have behavioral issues. So very important that early on we're helping them with with self-regulation, both behavioral and emotional self-regulation. Social skills, very important. The ability, if they're not able to interact, at least to tolerate being with others, the ability to work alongside peers, at least to tolerate being in the same area as others, to be approached by others, the ability to work alongside staff, ability to let staff and individuals know when they need assistance. All these really are built upon basic social skills and are necessary for your relatives to be successful as they transition into the adult world and adult services. And of course, specific vocational and day programming skills, which hopefully they've been exposed to in their high school or their school experience through job sampling and other opportunities, so that they are then prepared to go into adult programming. So some considerations that I think we need to pay attention to. One is that the best practice for the support of individuals who have mental health problems co-occurring with autism often involves medication medication management, and psychosocial supports. Sometimes this will take the form of behavior supports or behavioral shaping programming and necessary medication. Sometimes for individuals who are verbal enough to benefit from counseling, it will involve counseling and social skills training and medication management. So by psychosocial programming, I'm referring to non-medical therapy that can be provided in the form of behavior therapy or talk therapy or social skills development. Very important that, let me back up for a minute as I'm thinking about that out loud. I want to indicate that I know that we're talking to individuals in the audience tonight who have relatives who are on a full range of the spectrum. In other words, when we talk about individuals who have spectrum disorder, we're really referring to a heterogeneous group of individuals who have skill sets and many different challenges, and there's no one thing that I can say that will be equally true for everybody. So as I go through some of these suggestions, I suggest you think through whether or not that works for your relative, and this might be an option to explore, and one may, and another suggestion may not. One of the things that is very important to do is by age 14, in the IEP, begin to work in opportunities that will help your relative build the skills needed for a successful transition to adulthood. And been to a number of IEP meetings. Some school districts are pretty good at making sure that these opportunities are included. Others need a little bit more prompting, and families need to do a great deal of advocacy here. So these are opportunities for your relative to receive social coaching, behavioral coaching, and behavioral rehearsal. Social coaching is the ability to work with somebody so that your relative builds skills on site in social settings. So rather than attend a social skills class, they're working with somebody who can in vivo, in the moment, in the setting, prompt your relative about certain things they can do to handle their anxieties and best manage their social behavior in that particular setting. Behavioral coaching also involves the ability of somebody to work alongside your relative so that they're able to coach the individual about skills they can use to calm down, handle anger, be able to tolerate various stimulation and setting, and engage in strategies to relax and to become centered. Behavioral rehearsal is a technique that's used to help in coaching your relative through situations that are difficult. So the opportunity to anticipate with your relative, how is it going to be for them to go on a job interview? How would it be for their first day in day program? What are the kinds of things that they can anticipate? What can they do if they get nervous in a particular setting or with particular individuals? An opportunity to anticipate the skills they can put in place and to practice those skills before they need them so that they'll be feeling equipped when the time comes that they have to use those skills. So what are some of the opportunities that allow people to build the skills that they need in transitioning to adulthood? Well, volunteerism is probably one of the best ways. Having your relative who can tolerate and is capable of volunteering in community activity not only helps them feel a part of something, it also gives an opportunity for your relative to build skills in interaction and being task focused in completing tasks and getting into a routine. So volunteerism is one. Any way that increases your relative's communication skills. Remember, the goal in communication is that your relative should be able to communicate with individuals outside members of the family, so that your relative is not isolated and can freely interact with individuals in work and in their day programs once they have those placements. It's also important for the young adult to have some experience in simple decision making. To the extent that they can make choices, they can indicate their preferences to others. Allow or give your young adult opportunities to express their preferences as far as their clothing or their foods, menu planning or simple purchases. So they're getting into the habit of making decisions, because that is something that an adult does, and to the extent that they're going to be capable of doing that, they get into the habit of stating what their preferences are. To the extent that your relative is capable of learning even simple money management skills. A lot of this has to do with the capability of your relative. It may mean that you're a relative practicing how to make change of $1, of being able to go into a dollar store and use that, of being able to independently purchase lunch or to get items from a vending machine. Whatever level your relative is capable of trying to understand the value of money and being able to handle money even in a very limited way. The other thing that is extraordinarily important, and we see this a lot with individuals who wind up being very isolated because there's no transportation for them to programming. And to the extent that your relative can learn to be travel independent or travel ready and undertake travel training, they will be more independent and less dependent upon you to get them to various locations such as work or day programming. So by travel readiness, I mean helping individuals tolerate and become desensitized to traveling with other people outside of members of the family, whether it's taking a bus or a van or Medi-Transport or Access Link, whatever might be the appropriate situation. And in terms of travel training, if there are simple routes that the individual can learn to take so they can independently negotiate public transportation. Again, this is not something that everyone can do, but to the extent that somebody may be able to be travel independent, they are overall more independent. There's some considerations regarding programs, supports, and services. Prospective service providers should assess the current needs, preferences, and abilities of your relative. And that may sound, like, of course, that makes sense, but you'd be surprised how often individuals are placed in programs without an adequate assessment done, and then there is a mismatch from the very beginning between what your relative may need and what they're receiving. Good programming builds upon identified strengths and preferences, but it's also needs cognizant. And by that I mean there are opportunities not only for the individual to continue preferred activities and build upon what they're good at doing, but opportunities for the individual to learn to get better at certain things that they're currently weak in doing. Good programming aims at equipping your relative to be as independent as possible. And good programming should include measurable goals and objectives or outcomes that are to be achieved within a specific time frame. Good programming is also periodically evaluated, and the results of this evaluation are used to modify the program as needed. In other words, if something's not working, we should find out about it relatively soon and use that information as feedback to revise programming to make it more successful for your relative. And you may be thinking, well, why am I talking about this if we're talking about transitioning with autism and co-occurring mental health issues. And the reason I'm talking about this is that I find that one of the best ways to help a duly diagnosed person, somebody with a developmental disorder such as autism, and a co-occurring mental health problem, is to make sure that they have resources and they are equipped in terms of programming, they have something to do and something meaningful. A lot of the individuals we see in our crisis response program are sitting at home. They are not in programming. They are not doing anything other than doing video games, or there's been no placement for them. And they have ample opportunity to get into trouble. There are behavioral issues. They're depressed. They do not have anything meaningful going on during their day, and they're at risk for having increased behavioral and mental health problems because of it. So again, support plans and services need to evolve with the evolving needs and preferences of your relative. Just as your relative is transitioning as they go from late adolescence into early adulthood, they're changing biologically, they're changing emotionally, psychologically, and in terms of their support needs. And any programming that they have needs to be flexible enough to evolve with their evolving needs. Again, there needs to be built-in a criterion timeliness for evaluation of success or failure. Very often I see programs that have been kept in place for a very long time with no particular evidence that the consumer has benefited from them. They haven't particularly built skills, they're not particularly happy in their programming, doesn't seem to be working, and yet it's the program that's been in place. It's almost as though it's petrified and there's nothing that can be done to change it. As again, good programming is something that evolves, is flexible, and can be modified as needed. By the age of 16, you probably know that your relative, if not already identified for linkage with DDD, can be identified. As you know, with the changes in the service system, it's not until the age of 21 that an individual found to be linkable to DDD will actually be getting services through DDD, but New Jersey Division of Developmental Disabilities will have people or accept that people at the age of 16 can be identified, so that when your relative turns 21, you don't have to wait for the process of identifying their eligibility. And you need to also consider separately from linkage with DDD, linkage with the Division of Vocational Rehab Services. To what extent will they be able to get job coaching, job sampling opportunities, and actual placement in employment or programming or additional training through DVRS, that is the purview of DVRS and not necessarily of DDD. And also consider any kind of behavioral shaping in or counseling at this point in time to support your relative's transitions. This is the time that if you identify that your relative is overwhelmed by anxiety, is depressed about changes such as moving away from friends or friends moving away from your relative, that this is a good time to have your relative who's more verbal to talk to somebody, or to have a behavior shaping program if there looks to be emergence of certain difficult behaviors that will interfere with their placement in work or in day programming. Developing a personal schedule and positive routine. Because many of our youth and young adults on the spectrum do best with structure and routine, it is helpful to find ways to regularize their eating, sleeping, hygiene, grooming, other self-care activity, and chores. So it becomes very difficult if somebody is staying up until 2 or 3 o'clock in the morning doing video games to get up the next morning in time to make the bus to program or to work the next day. So the lack of a regular schedule can certainly throw somebody off with regards to their ability to be functional the next day, and which has implications for what they can do as adults. It is not unusual for individuals on the spectrum to have what's termed disturbance in circadian rhythm that leads to poor sleep habits and can affect the ability to work or participate in programming. So you may need to find professionals who've identified themselves as working on what we call sleep hygiene. Sleep hygiene is the routines that can be established that promote the individual being able to sleep. You may want to discuss with your the primary care physician or psychiatrist, depending on whom your relative is working with, the use of medication to aid sleep. And then for some individuals, referral to sleep disorders clinic to rule in or rule out sleep apnea or another sleep disorder. So again, regularization of eating, sleeping, hygiene, and grooming has implication for your relative's ability to interact with others, your relative's ability to get a job and keep a job, and with your relative's ability to maintain attendance in day programming. Again, with adaptive skills, the goal is for your relative to be as independent as possible. Encourage your relative to be independent and self-care is feasible, even if this is time-consuming. Encourage your relative to accept assistance from others for personal care in areas in which he or she is not independent. One of the biggest problems we hear about in the community are individuals who will not allow staff to work with them in providing personal care and assistance. So it not only burdens families, it means that the individual remains dependent upon family in a way that is not age appropriate. So we also want your relative to receive training if necessary and learn how to request help or signal that he or she needs assistance from people in work, from people at day program. So again, people other than members of the family are able to work with your relative. Try not to become involved in the provision of personal care to your relative once they reach late adolescence. There are many family battles that can be avoided or diminished by arranging for professional caregiving to be involved in the provision of care. Your relative who needs assistance needs to learn how to work with others other than members of the immediate family. Communication skills. Your relative needs to be able to communicate with others outside of the family. And again, I keep on emphasizing this because as a clinician, I continually come in contact with families who are not able to get their relative out of the house, not able to get their relative to interact with professionals, not able to get their relative to communicate with people outside of the immediate family, or if they communicate, they do so idiosyncratically that only members of the family understand them and no one outside the family understands them. This becomes very difficult, especially if your relative is somebody who's going to need care or help from other than members of the family. So of course, for those individuals who are minimally verbal or are difficult to understand, there is the possibility of the use of the picture exchange communication system. Many of you have that in place for your relatives at this point in time, or functional communication devices. And the earlier on that your relative has had verbal behavior therapy, for some people that has been very effective in shaping functional communication skills. So communication becomes very important as a bridge for your relative to the outside world. Social skills. Youth need to learn pro-social behaviors so they can attend programming, work, or live with others. Social coaching is one means to help with that. Social skills groups which are offered by professionals throughout the state. And then I would direct you, if you haven't already visited Carol Gray's center, and it's worldwideweb.thegraycenter.org, for her social stories and comic strip conversations. She's developed quite a bit of material that helps the person on the spectrum think about situations, social situations in story form. And as I said, they come both as social stories and comic strip conversations. If you've not seen that, her website, or looked at the material, I highly recommend that you refer to that. Even opportunities for your relative to participate fully in family functions and community-based activities during which your relative has an opportunity to interact with others and becomes comfortable being around other individuals. This becomes extremely important as they transition to adulthood. Utilizing community-based resources such as YMYWCA, YMYWHA, faith-based groups, community recreation programs. Many of our communities in New Jersey have very good community-based recreation activities in which, and they can be very inclusive of the individual on the spectrum. ARC has really good programming, as does several of the other agencies in the state. TCNJ, the College of New Jersey, has a summer institute that is devoted to developing employment skills. I don't believe they're running the Summer Institute this year, but I believe they will be running it in the summer of 2015. You might want to check out the website for the Autism Center at TCNJ to be updated about those opportunities. And we have Special Olympics. Actually, the national games are coming to New Jersey in June 14th through 17th. Special Olympics will be hosted by TCNJ in the Princeton area. So that becomes another way in which your relative can be involved with peers and increase contact. Working with professionals and staff. Well, many individuals on the spectrum have co-occurring mental health issues or under the care of a psychiatrist. So psychiatrists are there for the medical management of mental health disorders. Neurologists, many of the individuals on the spectrum whom we deal with are treated by neurologists for ADHD, seizure disorder, or other neurological conditions which impact upon your relative's wellness. The primary care physician can help coordinate input from all the medical professionals to make sure that your relative does not have fragmented care. Individuals on the spectrum who have co-occurring mental health issues are very complex because they may have medical issues as well as mental health disorders, and the kind of medications they receive needs to be coordinated. Behaviorists are there to develop behavioral shaping plans that not only reduce target maladaptive behavior but increase adaptive coping skills. As your relative transitions to adult services, you will see there are less ABA behaviorists in place. In some of the school systems and programs, you have BCBAs, BCABAs, who are trained in applied behavior analysis. That has been much more true for the academic world than it has been for the world of adult programming, unless it is autism-specific programming. Those day programs or work programs through such places as Eden or other agencies that specialize in work with people on the spectrum may indeed also have behavior shaping programs, including BCBAs. But generally, your general program for individuals with IDD do not have ABA certified behaviorists. Counselors can provide opportunities for your relative to learn social and emotional coping skills, how to handle anger, how to handle stress, and social anxieties. I head a crisis response team that is for adults 18 and older. It is not an autism specific crisis response team. It's for all individuals 18 and older with an intellectual or developmental disability. So you should know that when your relative acts in ways that are dangerous to themselves, self-injury, suicidal, aggressive behaviors such as aggression towards others or property destruction, and the usual strategies that you have in place are not working to keep them safe, it's time to call 911. If your relative's behavior has been deteriorating or maladaptive behaviors have been escalating, you can call Perform Care if they are under the age of 21. And that call needs to be made by a parent. And the number is 1-877-652-7624. And they will send somebody out. There are mobile response teams for children that will come and do a face-to-face and identify what kind of supports that your child needs. If your relative's behavior has been deteriorating or maladaptive behavior is escalating, and your relative is 21 or older, you call my team, SCCAT, 888-393-3007. And we will come out, do a face-to-face, give you some recommendations about what can be done to help manage the situation a little bit better. And if necessary, if your relative is needing hospitalization, we will make that recommendation as well. If your relative needs to go to the ER, do not escort your relative yourself, but have him or her transported. You can follow along the emergency transport or meet your relative at the ER. If your relative is assessed as needing hospitalization, it is possible they may be admitted to a voluntary unit or involuntary psychiatric inpatient unit. And among those options, if they're 18 or older, is the specialized unit at Trinitas, which is the only unit in the state dedicated for people with intellectual and developmental disability. However, many individuals who need hospitalization can benefit, if they need it, from hospitalization and the local short-term care units or voluntary units. For individuals who are under the age of 18 on the spectrum, they qualify to be on the Children's Crisis Inpatient Services. There are 8 or 9 of those units in the state. Trinitas does have specialized beds for children with mental illness and developmental disability. So that those are among options that sometimes are available to you. So promoting choices and preferences. Provide your relative with opportunities to make choices and indicate simple preferences. This gives your relative an opportunity to develop a history of choice making. When your relative reaches 18, he or she becomes his or her own guardian. If your relative is not capable of making informed decisions with regards to medical, legal, or other areas of decision making, then you should consider initiating the appointment of a guardian, which is usually a family member or it can be a state-appointed guardian. There are 3 main types of guardianship in the state of New Jersey, well, in most places. Either you're your own guardian, and that happens at age 18, and that means you can make your own decisions on your own behalf. Or if you need decision-making assistance in some areas, let's say you can't make decisions about medical, legal, or financial issues, however, you can make decisions in other areas like residential, employment, and social, then you can have what's called a limited guardianship, in which you have somebody who's appointed, a family member or state guardian in just certain areas, but your relative retains his or her own guardianship for other areas of decision making. Somebody who's not capable of making decisions in any area and needs a plenary guardian that is the full form of guardianship, and it can either be a family or a state-appointed guardian. I want to direct you to the fact that there are many resources available for families and for the individual with autism to think about entering into adulthood and some of the challenges socially, emotionally, and psychologically. So autism in the movies, there was a picture in 2009 called Adam. There was a picture in 2004 called Mozart and the Whale. You may remember a movie that came out several years ago about Temple Grandin. And there's an animated series, webisodes, that comes from Australia called Mary and Max, which is not only entertaining but actually raises some issues about the relationship between an older individual on the spectrum and a young girl as friends who correspond with one another. Additional suggestions you can obtain by going online and searching autism or Asperger's disorders in the movies or movies about autism. Wanted to, before we end, talk about some resources for families. One wonderful resource for families, if you have not yet had the opportunity to connect with them, is Mom to Mom, which is through Rutgers, and is mothers who have experience with individuals who have disabilities. Their own children have disabilities, and they are peer counselors and can be extremely helpful as well as informative, a good form of support. We mentioned Perform Care before. That is for individuals who are below the age of 21 and are going to need some mental health or behavioral assistance. And again, the number is 877-652-7624. I threw out the number for my crisis response team, SCCAT, Statewide Clinical Consultation and Training. That's for adults and with intellectual developmental disability. And we certainly come out to see anybody who's 21 or older. If your relative 18 to 21 winds up being hospitalized, we will follow your relative in the hospital, and when they are discharged, they'll be relinked, either Perform Care if they were linked before, or CMO if they were linked before. Psychologists or other mental health clinicians can work with your relative to help them with anger and stress management skills. There are a number of wonderful toolkits, and I only put two of them on my slides. One is from my team, Donna Iacovino and I. Donna Iacovino is a family advocate, and I wrote in 2009 the Family Crisis Handbook, which can be downloaded from the SCCAT website. The SCCAT website is SCCATNJ.org. And if you go under the tab that says News and Events, you can get a downloadable version of the Crisis Handbook. And it gives you an idea of what happens if your relative needs to go to the emergency room and how that is processed within the mental health system. However, it also gives you some suggestions about how you can handle crises before it escalates to the point of your relative needing to go to the hospital. And Autism Speaks has a number of excellent toolkits. One that you might want to look at relevant for individuals transitioning from adolescence to adulthood is the Employment Handbook. And if you go onto the Autism Speaks website, then you will be able to download this free of charge. So at this point in time, I think I am going to stop and ask if there are any questions. Again, I am Lucy Esralew. I'm the clinical administrator for the SCCAT and SCCAT programs at Trinitas Regional Medical Center. And for those of you who can see my slides, I have put my email address, which is lesralew@trinitas.org. So at this point in time, I will be quiet and wait to hear from you if you have any questions.
Dr. Esralew, thank you very much. We do have a few questions that are coming in. The first one that I'm going to read is from a family member who has a 16-year-old with a diagnosis of autism. The family is still bringing the child to see a pediatrician, and they want to know who they should move to and at what age, and also, is there a directory for family doctors?
Unmuted.
Well, there are doctors who certainly have a little bit more experience with individuals with IDD. There are also certain areas. So, for instance, there is the clinic or the center in Morristown, the DDC, the Developmental Disabilities Center. Probably, at some point they should move to I would say, a primary care physician. And one of the possibilities is that ARC of New Jersey, through its medical mainstreaming project, might very well have a directory of individuals, and Autism New Jersey may have a directory of individuals. And again, they're not going to recommend going to one or another physician, but they may be able to help put the family in contact with physicians who have indicated that they have expertise in working with young people on the spectrum.
Thank you very much. The next question is, does a mental or behavioral health issue typically present as a sudden onset or as something that presents gradually?
Unmuted.
Very often individuals who wind up being diagnosed with a mental health disorder, and this may not be a diagnosis that they officially get until they are in their late teens or early 20s or so. Usually there have been some signs of this beforehand. So I'll take one example because there are different mental health disorders. So let's take the issue of bipolar disorder. Very often we'll see that the child has had mood issues and mood regulation issues throughout childhood. I mean, there may not be continuous, but there have been multiple episodes leading towards an actual diagnosis. The same thing tends to be true for schizophrenia, schizoaffective disorder. It is not often the case, at least it's not been in my experience, that you suddenly see the onset of a mental health condition in late adolescence or early childhood without there having been some indications earlier on of some issues.
Dr. Esralew, you actually answered the next question with that response, so thank you. The last question I'm going to give this evening is anger management skills and stress management skills. What titled professional can assist with this? Would this be under a behaviorist?
Unmuted.
It can be under a behaviorist, with which the individual will learn specific skills in how to manage anger, or it can be through counseling or social skills. So this can be done with a psychologist. This can be done with a social worker, a licensed professional counselor, or a BCBA. So there are multiple approaches to anger and stress management. For those of you who have a relative who is higher functioning on the spectrum, who has what has been referred to as Asperger's or high functioning autism, you may want to read a book by Valerie Gause, G-A-U-S-Z, and she writes about the cognitive behavior treatment of anger problems among people with Asperger's or high functioning autism. So there has been a lot about how you can use therapy with individuals who are verbal enough to work on it. Otherwise, social skills development or behavioral shaping, those are very legitimate ways of working on anger and stress management skill building.
Thank you again. We did receive a lot of general questions this evening that were not specific to tonight's topic. I do want to refer anyone with these general questions to please call the Family Support Center of New Jersey at either 732-528-8080 or 1-800-FSC-NJ-10 to speak with one of our really experienced and knowledgeable resource coordinators to assist. We did also get some great suggestions coming from the audience, and I know a lot of people were looking for Dr. Esralew's PowerPoint, so we will try to put all that into an email and share that with you by early next week. On behalf of the Family Support Center of New Jersey and Transition Matters, we would like to thank you for sharing your evening with us. Please explore the Transition Matters website at transitionmattersnj.org for upcoming trainings and webinars such as this. And following this webinar, you will see a brief 3-question survey. We encourage you to participate so we can better serve your future needs. This concludes our session, and we wish you a good night. Dr. Esralew, thank you very much. We're happy you were able to join us.
Unmuted.
Thank you, and good evening, everybody.